Hello everyone, my name is Douglas Nelson and I'm the founder of Precision Neuromuscular Therapy. Thank you very much for your interest in Precision Neuromuscular Therapy, Form and Function. This particular seminar is very different than our other seminars in that in this seminar it's very much process-driven rather than content-driven. In the other seminars, it's all about here's how you treat this, here's how you do that, here's how you approach this, and it's, as you know, content-rich and information-dense. In Form and Function, we step back from that a little bit and look at a larger framework, which is not content-driven, but process-driven. It's about the decisions you make and how and why you make them. And to be honest, there are lots of different ways that you can approach this. Our goal is to be really clear about what we're doing, why we're doing it, and the intended consequences. What are the expected outcomes? How will you know if you're on the right road, and how will you know if you're on the wrong road? That feedback mechanism is enormously important, and it builds a sense of a framework, a scaffold around which the work is built, and also instills a sense of deep confidence for the therapist to be really clear about what you're doing, why you're doing it, and maybe sometimes more importantly, what happens when your go-to strategy doesn't work? And guess what? That happens a lot. So what's your plan B? And what's your plan C and D? And by what criteria do you make those decisions? I love that decision-making process because with 40 years in the clinic, that's really where the rubber hits the road. And it's essential to having a mastery of this work. So in the seminar, once we do that larger kind of overview of problem solving and strategy, then we will step back and we'll look at different assessment techniques. And the assessments, I think you'll be surprised in that they're insanely fast and also very, very accurate. The key is to be able to make those decisions. When I say assessment to most therapists, they have this idea of a clipboard and a pencil and running through a bunch of tests, and honestly, everybody hates that. Therapists don't like it, clients really don't like it. You must be able to do the assessments almost on the fly, and I love assessments that are veiled where the client doesn't even realize assessments actually happened. So we'll go through pelvic assessment. That will take probably at least 4 hours, and then we'll start looking at different parts of the body, from the feet to the spine to the shoulders to the neck. We'll take all these different pieces and then we'll put all the pieces back together again. And in one part of the seminar, you're going to be doing kind of structural assessment in 0.9 seconds. Just, again, incredibly fast, and I think you'll be surprised at how accurate you will be able to be. Then we'll do some scenario case study, again, making sure that these kind of principles can be applied, because if you can't apply it, it's not going to help you Monday in the clinic. And for us, that is really, really important, that everything we teach, you should be able to apply to make a real difference in people's lives the next day, because that's what this is really all about. So I think you'll really enjoy the process. I think you'll enjoy the seminar, and I look forward to meeting you. Thank you so much.